1 in 12 women will be diagnosed with breast cancer in their lifetime. April 17, 2019 was 4 years ago when I finished my breast cancer treatment, and in this video I want to talk about what you can do to reduce your risk of breast cancer. Hi, I'm Ala Shapiro, spa owner of 2 Woodhouse Day Spas in New Jersey, and this is the Spa Runner channel where I cover topics such as health, wellness, and beauty. About 5 to 10% of breast cancer cases are thought to be hereditary, meaning that they result directly from gene changes, mutations passed on from a parent. This means that 90 to 95% of all breast cancers have other causes such as environment and lifestyle. We have little control of our environment, but we definitely have a lot of control in our lifestyle choices, so let's talk about them. And in my case, it's definitely not hereditary. We don't have any breast cancer. We really don't have much cancer in our family, so I was totally shocked when I was diagnosed at age 44. If you're finding value in this video, please give me a thumbs up. It will make a huge difference in growing my channel. And if you stay until the end, I will tell you my story of how I got diagnosed with breast cancer and the treatment that I received. Research shows that lifestyle changes can decrease the risk of breast cancer, even in women at high risk. To lower your risk, avoid these things. Let's say you avoided all mentioned above in your life and you ask me if there is anything else that you can do to reduce the risk of breast cancer, and the answer is yes. You can do the following. Be physically active. Physical activity can help you maintain the weight, which helps prevent breast cancer. Most healthy adults should aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity weekly, plus strength training at least twice a week. And by the way, I did all these things and I still got breast cancer. So I don't know what it was, if it was environmental. In my particular case, I did live in the area close to Chernobyl when I was a kid, so I was exposed to radiation. I went to school close to 9/11 sites, so people who worked or lived close to 9/11 also at higher risk. And I also worked at another place which I think was a dumping ground for chemicals. So I was exposed to environmental factors that were beyond my control. But now that I went through breast cancer, I do all these things to reduce my risk, and I hope that I can do that. So second thing is, if you have any baby breastfeeding might play a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. Limit postmenopausal hormone therapy. Combination hormone therapy may increase the risk of breast cancer, and there is all kind of research and it's all over the place. At this point, I think it's definitely beneficial to feel great, but I think for the purposes of breast cancer risk reduction, it's not great to do postmenopausal hormone therapy. Next thing is have a positive mindset. Researchers continue to explore the effects of positive thinking and optimism on health. Health benefits that positive thinking may provide include, and here we go, consume cruciferous veggies, which are arugula, bok choy, broccoli, Brussels sprouts, cabbage, cauliflower, collard greens, horseradish, kale, radishes, turnips. And in addition, cruciferous vegetables contain a group of substances known as glucosinolates, and I don't know how to pronounce it, which are sulfur-containing chemicals. These chemicals are responsible for the aroma and bitter flavor of cruciferous vegetables. During food preparation, chewing, and digestion, the glucosinolates in cruciferous vegetables are broken down to form biologically active compounds such as indoles, nitrites, other things. Here you can read them because I don't know how to pronounce them. And these chemicals have been examined for anti-cancer effects. They have been found to inhibit the development of cancer in several organs in rats and mice, including the bladder, breast, colon, liver, lung, and stomach. And I recently made a video about how green vegetables affect your health and prevent major disease, and you can watch it here. Reduce stress, consume organic foods, get a low-carb diet, and I actually made a video about low-carb foods, and you can watch it here. Do intermittent fasting. Eating healthy diet might decrease your risk of some types of cancer as well as diabetes, heart disease, and stroke. For example, women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts might have a reduced risk of breast cancer. The Mediterranean diet focuses mostly on plant-based foods such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil over butter and eat fish instead of red meat. By the way, I have a playlist about 6 G-bombs which can prevent you from a risk of major diseases, and you can watch it here. What else can you do? Be vigilant about breast cancer. If you notice any changes in your breast, such as a new lump or skin changes, consult your doctor. Also, ask your doctor when to begin your yearly mammograms and other screenings based on your personal history. Additionally, if you have dense breast tissue, it is recommended to do both 3D mammogram and ultrasound. In some cases, MRI is the best tool for detection. And like I promised at the beginning of the video, here is my breast cancer story. At the age of 44, I went for my routine mammogram and then I received a report which called for more imaging. I didn't take it seriously and probably waited a few months too long before scheduling that appointment. I watched videos of other cancer patients and survivors, and this is so common not to take things seriously. You just don't believe that it can happen to you. You really think it's like nothing. Some people in these videos have symptoms and avoid going to the doctor, and some just prolong going to the doctor for the follow-up. I'm not sure what that is. Possibly we just don't believe that cancer can happen to us until it does. So my suggestion is do not skip your mammograms, and if you are being called back around, do not walk to the follow-up appointment. At the follow-up mammogram, they found the area of concern and I needed to go for a biopsy. Okay, let me tell you something. That was the worst part of the whole process. I seriously do not understand why they do not knock you out for that, because not only it is psychologically draining knowing that they may find something horrible that will change your life forever. It is also very, very painful. January 2nd, 2019, the doctor who performed the biopsy called me and told me the news. That was probably the hardest time because you are still hoping that they will not find anything. And then they do, and you have to figure out your plan for treatment. And it is not the easiest thing to navigate the medical system. You really need to move and research and talk to people and to figure out the best doctor that you can find. Luckily, I live in New York area where we have the best of the best cancer treatment center, the Memorial Sloan Kettering Center. I found the best doctor I could find and made an appointment to see her. The treatment plan was lumpectomy, which is a surgery to remove cancer, and then 4.5 weeks of 5 days a week radiation treatments. The surgery went fine, and I was lucky that I was only stage 0 breast cancer, which is very treatable. I did break down once during the first day of my radiation treatment. I just could not stomach the thought of all that radiation going through my body. But through meditation and self-hypnosis, I was able to deal with that ordeal. I was tired all the time, but I didn't allow myself to sulk and be depressed. And if you were to see me then, you would see how slowly and difficult it was to walk. It was not fun. The constant thought that I have cancer would not leave my mind. I do practice all the things that I talked about earlier in this video to avoid my breast cancer recurrence risk. This is not something I ever want to go through again, and I hope this information helps someone to avoid this very difficult experience. I did make a video on cancer fighting, or shall I say cancer risk reducing salad a while ago. That salad is packed with cruciferous vegetables and all the other good things that you need to reduce your risk of any cancer, and you can watch that video next.